Q&A, which are great. What we're going to do is go on to hear from Dr. Az Hakeem, and he's going to talk a bit about his practice as a psychiatrist and with his great expertise in gender dysphoria. And he's going to offer a clinical perspective on both affirmation and conversion. So over to you, Dr. Az.
Diolch, Sarah. Bore da pawb. Diolch I chi am gofyn I fi siarad wrthych chi heddiw. I better switch to English, haven't I? But anyway, so just to put you in context as to who on earth I am and why I'm on your screen, I've got the unusual accolade of being the only consultant psychiatrist in the UK who, in medical psychotherapy, who has specialised in psychotherapy for gender dysphoria. Unfortunately, I'm the only one. Maybe it's not that interesting a field. But how did I get into it? I suppose what's relevant is I grew up as in probably the only brown family in Abergele, North Wales, in the early 70s. And I remember saying to my mother when I was started school at 8, I said to my mother, "Mummy, I don't think I should be brown. I think I should be white like everyone else." And her task then wasn't to say, "Oh, well, you're trans ethnic. We need to ethnically cleanse you and bleach your skin and make you into the white person you identify as." Her task then was to allow me to expand my repertoire of what it was to be brown or white, or whatever it was, and accept my identity as me. And I think that's relevant to the whole gender thing, especially when you've got children who are saying at the age of 3 or 4 or 5 or 8, I don't want to be a boy, I want to be a girl. And I think it's what on earth is their understanding of what is a boy or what is a girl? And we shouldn't just presume that they have an adult understanding of the world when they're 8. So I went into medicine, my first job I nearly became a fine artist. I couldn't decide whether to do fine art or medicine. And I applied to both fine art and medicine. I got into both, and I decided the day before, rather haphazardly. But when I went into medicine, I thought the whole trans thing was great. I thought it was the ultimate sculpture. You can turn men into women and women into men. This is great. My first job qualifying as a doctor was in plastic surgery in London. I used to help the surgeons assist in my very junior role in the gender reassignment operations. So I thought, this is great. We're transforming people into other sorts of people. Then I thought there was something a bit strange about it, because no one seemed to be thinking about what was happening in their head. So I went into psychiatry, and no one in psychiatry seemed to be thinking about it either. So I went into psychotherapy, and I trained at the Portman Clinic, which is a forensic psychotherapy who specialise in anything to do with sex, gender, sexual perversion and violence. And they gave me carte blanche to do what I want, actually. So they let me set up a gender dysphoria psychotherapy service, which I set up as soon as I started there in 2000, and I ran that single-handedly until I left the clinic and left the NHS in 2012. I continue to do it privately now. And I went in there with a quite clear, straightforward understanding of what trans was, and with the help of my patients over a decade, I left with a far more complex understanding of what it is what trans means. And what was clear was that there is no such thing as trans. What there is it's a heterogeneous assortment of lots of different situations or conditions which have been given this umbrella of trans, but they're all very different. And gender dysphoria is a symptom. It's not a condition, it's a symptom. It's like a cough. And you can have a cough because there's something stuck in your throat, because you've got a chest infection, because you've got lung cancer, because there's all sorts of reasons why you can have a cough. So presenting, saying, I feel like I'm the wrong sex or the wrong gender, is a symptom like a cough. It's not a thing. And there's not one solution that fits all. And what I learned was that you've got what used to be called the classic true transsexualism, which is people who from a very early age have a very binary fixed cross-gender identification. And what I found is that almost 100% of those people would be on the autistic spectrum. And I'll come back to that. You've also got the people who were formerly called transvestites, either the dual role transvestites, who know they're not the opposite sex, but they like to go to spend time masquerading as the opposite sex, and the fetishistic transvestite who gets sexually turned on by that. And in my book, plug the book, my book's also available in Russian, if you're Russian. In my book, I describe 11 different types of transvestite. So you've got the true transsexuals, you've got the 11 different types of transvestite, the ones that get turned on or not and how they get turned on. And then you've got the autogynephiles, who are men who are sexually turned on by the idea of having female bodily parts. So it's not a gender identity, it's a sexuality. And you know, if you're a man who spent years getting turned on by the idea of having a vagina, it's quite embarrassing to tell your GP that. So the ones I've seen are people who've just got on a plane and gone to Bangkok and had a vagina fitted, and then realized it was an awful mistake and they don't want their vagina because their libido had gone because they've been castrated. So they're not trans either, but they are trans in these days. And my work was also, there was massive overlaps with other things. So like I said, the ones who had very fixed black and white thinking, I'm the opposite sex, were my hypothesis anyway, is that they are almost 100% on the autistic spectrum disorder. Those who are less autistic are more likely to be the transvestite, or autogynephile, or ambivalent. And there were also other, like trauma, there were lots who were born in certain conditions. There was a huge amount of internalized or externalized intolerance to homosexuality. And what was interesting was that this notion that these people are born in the wrong body, you give them what they want and then they're free, was a fiction. So my population sample that I treated, 26% of the people who were referred to me were post-operative regretters. And these were all people who were invisible to statistics. So nobody had followed them up. It's the one medical intervention that I know of where there's no follow-up studies. And the idea is you don't follow them because you're giving them what you want. So my 26% of my patients who were post-operative regressors, they said, we spent years convincing our GPs, our psychiatrists, and our gender clinics to give us what we wanted. Most of them said, there's no way we're going back now and saying it was a mistake because it's embarrassing. The ones who did go back were told there's nothing we can do because we gave you what you wanted. And with them, it was often a piece of mourning work and trying to sort of rebuild a life with a sense of regret. But they were invisible to the people who support this ideology. The idea that it's not always the right thing to do. They're the ones who they don't like to be talked about because they're off message. But they're very important because they remind us that it's not this simple solution. My concerns about the proposals of the Senate are multifold. I mean, firstly, trans isn't a unitary condition. It's a collection, it's an umbrella term for many things, including what used to be called true transsexualism. It incorporates 11 different types of transvestism. It incorporates sexual fetishes of dressing as a woman when one doesn't identify as a woman, which includes men who would like to get into female spaces. I said I worked in a clinic which is a forensic psychotherapy clinic, and I've seen firsthand sexual, what we would call sexual perversion perpetrators who would look for opportunities in order to, or for example, the flasher would look for opportunities in order to be able to access spaces, or the voyeur, or the frotteur. The frotteurs are the people that like to rub against people. So there's a myriad of sexual perversions where people look for the opportunity in order to gain access to be able to act out their perversions. And people like to think that perversions don't exist, or it's an outdated term, and they think, well, perversions are something that people who buy fluffy handcuffs in Ann Summers do. I'm talking about proper perversions who have clinical significance. And I used to work in high security in Broadmoor as well. So, and the idea that men who self-ID as women are just sort of trapped in the wrong body is naive and simplistic. And if you follow social media and Twitter, you'd have seen that there seems to be this upsurge in men who have convicted of rape or other sexual offences who are suddenly self-identifying as women. I mean, that's not a coincidence. So so one concern is that there's this sort of heterogeneous umbrella of conditions, and the other thing is with children, this affirmation of children, this concept of rapid onset gender dysphoria, which we're all aware of, this sudden overnight, I'm non-binary, I'm trans, coming home from school. I mean, my idea and the idea of many other clinicians is that this is, best intents and purposes, this is a medicalized youth subculture. And those of us who are Generation X and pre-Generation X are very familiar with the idea of youth subcultures being music-based. I was a goth. I was a massive goth. I went to school one day and Jenny turned up with back-combed hair, lots of eyeliner. We all go, oh my God, what are you? And she said, I'm a goth. Within a week, there was an epidemic of goths in my little school in North Wales. And that was an identity, we were proud of it. And luckily there was no goth clinic for me to have permanently tattooed lips and eyes, and it was very subversive. And if you look at any photos of me or my friends as a teenager, you'd probably think I was a transvestite, because there was nothing particularly male looking about me. And I turned up at university with rose printed leggings and a long pink Mohican and more makeup than most women wear these days. And the whole point of being a teenager in a subculture is to be subversive and challenge boundaries and turn things on its head. And it's normal for teenagers to be subversive. And if you think about the other subcultures, like the New Romantics in the 70s and 80s, Boy George, Marilyn, it wasn't about gender. You look at them, you're thinking, oh, they're girls, and they're girls, they're boys, but it wasn't about gender. It was just about being subversive. And as a friend of mine who worked in the music industry said, up until the advent of social media, youth subcultures were based in music, and music was the identity. And then when social media came along, youth identity and subculture got taken over by one social media profile. So now kids, music is just music. Whereas if you're Generation X and before, or pre-social media, then your musical identity was your subculture, whereas then social media took over. So what I'm trying to say is that ROGD, rapid onset gender dysphoria, is basically the current version of a subculture. You come home and say, oh, Jenny's non-binary, oh, I'm non-binary. And if I talk to any, because I see people sort of late teenagers from 17 onwards, and when they've suddenly come home from school with no previous gender dysphoria, they suddenly have gender dysphoria, it's not really gender dysphoria, it's Goth Mark 5. Goth Mark 4 was emo. Goth Mark 5 is non-binary or trans or ROGD in kids. It's not really a clinical condition. It's a subcultural identity, and the concern is that we've then medicalized it into a medical thing. Also, when you have a child who's very young, like the 4-year-old, the 3-year-old, who says, "Oh, I want to be a girl, or I want to be a boy," the normal response for a parent would be to go, "Really?" Like my mother did when I was 8. Really, what's so good about being a girl? What's so bad about being a girl? What's so bad about being a boy? What is a girl? What is a girl? What is a boy? But now you've got teachers who have been who really want to do their best. They're not evil, nasty teachers. They're really trying to do their best, but they're being trained wrongly by things like Stonewall and Mermaids, by doing this sort of affirmation approach. So if you've got a child who is understandably confused and says, oh, I don't think I want to be a boy, I want to be a girl, or vice versa, you've got a teacher who's then iatrogenically encouraging a gender dysphoria by going along with it, saying, yes, that's because you're trans. Well, I've had parents who've watched a 30-minute documentary on Channel 4, and then when their 4-year-old has said, oh, I don't think I want to be a boy, I want to be a girl, they've actually said to the child, oh, that's because you have a clinical condition, you're trans, and don't worry, you're trapped in the wrong body, and we're going to save you from it, we're going to give you hormones and stop your puberty, and then when you're 18, we're going to give you surgery, which isn't really the helpful thing to say to a 4-year-old. The helpful thing to say, really, what is a boy? What is a girl? Because they don't know, they're 4. They don't know what being a boy or a girl is. You know, you might want to be a goldfish, but you don't change your child from a goldfish. You just sort of adopt this curious position. But unfortunately, if you adopt this affirmation only doctrine, then oh, am I speaking too long? Have I gone on? I just read my little chat message. Sorry, but apparently I forgot to shut up. But if you've got this affirmation only approach, then I'll just be 1 minute. Then you're not allowing curious exploration, and you're actually doing another conversion therapy. I went on holiday to lovely Wales and South Wales, Pembrokeshire. I was the only person who could speak Welsh in Pembrokeshire. It's terrible. Actually, my introduction was the most Welsh I've spoken recently, even though I was in Wales last week. I'm not complaining. A friend of mine I was in Hollywood with said that one of the children in the school that a friend went to, who's very small, very young, primary school, is a girl, and she identifies as a girl. She's a bit of a tomboy, but identifies as a girl, a bit of a tomboy. And the teacher said to the girl in primary school, "Have you considered cutting your hair short and identifying as male?" This came from the teacher, not the girl, and the girl was very confused. So that's what the affirmation approach does. So I could go on, but shall I shut up?
I'm going to ask you to stop, even though it's absolutely fascinating. And I've got people go, oh, just let him go on. But I'm really conscious of everybody else.
I've never spoken for only 10 minutes of my life.
I do know that feeling. And I think that last point is so important, that we've actually got adults giving that idea to children, that really you're somehow in the wrong body, and I find that absolutely
no one's
terrifying.
bodies are wrong. Nobody's bodies are wrong.
Nobody's bodies are wrong. And certainly as a lesbian of a certain age, I'm really conscious that if that had been me at 14 or 15, that absolutely was the risk I took. And I also think there's something very important in what you said about what does consent mean. So, you know, people rubbing up against you in the tube, something many women are familiar with, you know, that is about taking power and control. It's not about some, you know, amazing kink we should all be proud to celebrate. It's just about trying to get control. I'm going to go on now because that was just fascinating, but I also really want people to hear from Sinead, who's the other part of that story, because she's been through the hard yards of transition and regret and detransition. A former trans man who detransitioned in 2019 and who's now advocating for proper care and support for people suffering from gender dysphoria. And it would be so interesting, after what Az has said, to hear that story from Sinead, who's been through it. Over to you.
Can you hear me okay?
Yep, we can hear
you. Well, as that very lovely and very kind introduction sort of told everyone, I am a former trans man. I identified as trans as a man for 6 years, which unfortunately for me included medical transition. So I'm not going to keep you too long. I just want to very quickly run through the timeline of my transition so that everyone can get a good idea of how long this type of thing takes. And then I'll make my point. So as was kind of touched on there, when I was a teenager, I experienced some very unfortunate things, in some cases, traumatic things that many young girls and women we experience it, and it's never nice. But for me, by the time I hit my 20s, I hated being female. I absolutely resented it, and I had this fantasy that if I'd been a man, that none of these terrible things would have happened. So in 2011 to 2012, I found transition material online, and I was like, okay, here we go. You know, I hate being a woman. I hate having a large chest. I hate everything that's happened. And here's all this material telling me that, oh, that means that you're trans. And so a little bit older than the demographic now, which I will touch on later because it's important, but I was, 20, 21 years old when I came to believe that I was trans. The following year, 2013, I came out to friends and family. I told them that I was actually a man. I told my mother that she actually had a son. 2014, I self-referred to my gender clinic. Now, I know in some places you need your doctor to refer you. In Scotland, you don't. You just call up the clinic and put yourself on the list and you can be seen. So it was a self-referral. In 2015, I got the call and they invited me up and we had a conversation. Now, I know at this point, a lot of you have probably heard that, oh, the evaluation process takes so long. Trans people wait years before they get the testosterone. I was seen, evaluated, diagnosed, given the prescription for testosterone, and began injecting testosterone under 6 months. So that process did not take very long at all.
You keep going, Sinead. We'll ask Kate to mute.
Yes. So 2015, again, there was no many years, there was no talk therapy. I was affirmed immediately. So upon my arrival, and let me just pronounce this bit for a minute, before they had even evaluated me, before they had even diagnosed me with gender dysphoria, they were using my preferred pronouns, they were using my preferred name, they were referring to me as a man or a trans man, before they even knew that that was the case. So I was affirmed immediately. There was no talk therapy. Don't want to make myself sound too crazy, but I did have a very detailed, long, colourful mental health history that the clinic was aware of. I'd had several mental breakdowns. I'd had suicide attempts. I had been on a psychiatric ward. I had an alcohol problem. I had a history of self-harm. They were very much aware that I wasn't well. None of that was spoken about. And instead, everything was put into the affirmation process. So I got the testosterone very quickly within a couple of months. And then over the course of 2015 to 2017, I would go regularly for my blood checks, my hormone level checks, because when you're a biological female injecting testosterone, you're putting yourself at great risk. You know, you're at a higher rate risk of heart attack and a whole bunch of other things. It's very dangerous for a biological female to be injecting testosterone levels at that level. So you need to go for your hormone level checks. But that changed in 2017 because I was referred for my double mastectomy, for which I traveled to Manchester for. But after that, I stopped going to the clinic. And I didn't cease my testosterone until 2019. So for 2017, 2018, and 2019, we're talking almost 3 years, I did not go back to my clinic for my blood checks, for my hormone level checks, and not once did they contact me and say, you need to get your checks. Not once. So that's obviously a concern, along with the lack of follow-up. In 2018, I began to realize that I regretted my transition. If I was to really go into detail about that, I would take far too long. So all I will say is I realized that all of the mental health problems, all of the issues and all of the trauma that I'd experienced prior to transition reared its ugly head. And I realized that pumping myself full of cross-sex hormones and cutting bits of my body off wasn't really addressing the mental health problems. So I had a very, very horrible and difficult time in 2018, but I didn't want to detransition. I thought, I've come too far, you know, I can't. So it took me a year and a half. In late 2019, I did cease the testosterone. And I officially detransitioned. I changed my legal name back. I changed my legal, they call it gender. It's not gender. I didn't get my gender markers changed on my legal documents. I had my sex markers changed. I got access to opposite sex spaces. So this whole thing about gender, nonsense. So I got my male changed back to female on my legal documents. And I started looking for other detransitioners. And I found a lot of them. And a lot of their stories were horrifically similar to mine, which is why I continue to, sort of speak about the things I speak about. And one of the things that I wanted to bring up here, just to let everyone know, there's a wonderful organization called Post Trans, which is run by detransitioned women. They ran a survey on detransition related needs and support. They found that 54% of the respondents, and there was 237 of them, reported that they had at least 3 diagnosed comorbid conditions, including depressive conditions, anxiety conditions, post-traumatic stress, a history of rape and sexual assault, autism, eating disorders, and some other things. They found that 45% reported that they had not been properly informed about the health ramifications of transition. And I'll include myself in that. I was not informed that vaginal atrophy was a side effect of testosterone. As a result of my testosterone use, I now have some mild incontinence. I was not told about that. So my main concern when it comes to transition, we now know that the vast majority, there's been a massive uptick in the UK and other places of mainly females, mainly young women and girls who are putting themselves into gender clinics. A lot of them have depression, anxiety, trauma, autism, eating disorders, body dysmorphia, and they're throwing themselves at these clinics and they're saying, I hate being a woman, give me cross-sex hormones and surgery. And we're saying, okay. And I wonder why. I wonder why I had to go through it. I wonder why all these other women, these are our daughters, these are our sisters, and they have all these other issues, but instead of addressing it because of political correctness, because we don't want to be called transphobic, because we don't want any of this or any of that, we're saying this is a good thing you're doing. You're beautiful and you're brave and you're trans. No, that's not what is happening. What is happening is that we have an increasing number of young women and girls who are going through a lot of things that unfortunately is very common for females. They're traumatized. They're going through a lot of really horrible things, and understandably, they resent being women and girls because of it, and they're trying to find an escape. We shouldn't be providing that escape. We should be providing help. We should be helping them. We shouldn't be creating this space where we can say, yeah, just pretend that you're not female, you're not, let's pump you full of these cross-sex hormones. Did you know that when biological females take testosterone, it dramatically increases their risk of a heart attack? Did you know that it dramatically shortens their lifespan? Did you know that it increases all of these other horrible things? But no, we're going to ignore that and say, yep, you're a trans man, you're beautiful, you're brave, and all this stuff. So what I do now is I talk about my concerns with this stuff, and among which Dr. The lovely Az spoke about prior to me, affirmation only is dangerous. I was affirmed upon arrival, and it was not helpful because it just convinced me even more that I thought I was a man. You don't want that from medical professionals. The lack of support for detransitioners is appalling. When I spoke to my GP and I was referred to a counsellor and a therapist, I brought up detransition. I brought up transition regret. They did not want to hear it. It was anathema to them. And I thought, okay, I'm completely by myself. I'm lucky that I found other detrans women online because the medical community wanted nothing to do with me. And I'm here to tell you now, I know for a fact that if nothing is done, there is going to be a massive tidal wave of detransitioners in the future, and there's no support for them. And we need it. We need the psychological help. We need the physical help. When you've had your breast removed, when you've had a hysterectomy, when you've had all of these physical ramifications that you can't undo. I'm only 30. Many of the detransitioners that I speak to are far younger than me. So we've been injecting cross-sex hormones. We've had body parts cut off. We'd have body parts cut out. We can't undo that. Why was that allowed to happen? Because the doctors were being polite and kind. Because how dare they question? This is ridiculous. We're not talking about some silly little thing that's just affirming an identity. We're talking about irreversibly damaging people. And I'm so sick to death of being told to be polite and be kind. It's easy for you to say that. You've never had the surgeon's knife taken to you. I can't change this. The girls and the young women I've spoken to can't change this. Why is this being done to us? I will finish my point before I go on too longer, just by saying that when someone begins to identify as transgender or transsexual or whatever it is, there's no need to be cruel. You want to speak to them, you want to find out what's going on, but do not affirm, not off the bat, because when you affirm someone in that identity, you're cementing it in their mind. When I was affirmed at my gender clinic, I put that in my little mental evidence file as, the clinic saying I'm a man, that means I'm a man. So do not affirm, question, challenge. And if you ever start feeling uncomfortable about how, oh, I'm not being kind, I'm not being polite, just remember one thing. The results of that affirmation is irreversible, harmful results from cross-sex hormones that do not belong in that body, surgeries that cannot be reversed, and body parts that cannot be replaced. It's not kind to affirm. Thank you.
Wow, Sinead, that's so powerful and so painful to listen to some of that, and so moving. And I'm reminded again of Sonia's question of why aren't we crying? It's so important to say that. And so, yeah, really, I find that very, very painful.